Anxiety and Depression, Environmental and Cultural Factors by Kristy Mayo and Shalise Watkins.
Cultural environment related to media. Portrayal in media often includes violence from mentally ill or depressed individuals towards others. In the 1980s, depression was classified as pessimism. By the 1990s, depression was becoming more normal, and celebrities became spokespeople for depression. Portrayals of mental illness are not only highly inaccurate, but also harmful to mentally ill people. People suffering from anxiety and depression are at greater risk for danger due to inaccuracies that make others hesitant to help them. Public stigma against mental illness is well documented and can prevent individuals from seeking treatment for these disorders.
Cultural environment related to family support. Positive family support dealing with anxiety and depression is usually long-term, where most other relationships provide short-term support. Positive support from family members result in fewer episodes of anxiety and depression. Negative family support or family conflict is known to be associated with poor mental health.
Cultural environment related to roles of peers. Positive peer experiences can improve mental and physical health by encouraging good behavior changes, such as exercise, diet, and smoking cessation. Peers can be powerful role models that lead by example, rather than telling others what to do. Individuals are more likely to become involved in programs that peers encourage them to join. Peers that are able to relate to problems and give advice for coping are more successful in positive change. Peer victimization causes anxiety and depression and elicits strong negative emotion. Peer victimization leads to long-term anxiety and depression through life and is a significant social stressor.
Cultural environment related to cyclic nature. The cycle of depression can start at any of the 4 phases: low energy, neglect of responsibilities, increased guilt and hopelessness, and depression, and continue to cycle. Breaking the cycle can begin with increasing activity levels and may require medication. Reversing the cycle of depression can mean increased activity levels that lead to feeling hopeful, greater motivation, and increased mood.
Cultural environment related to legal and political systems. The state offers help for anxiety and depression from Utah Department of Human Services. A helpline is available at 800-273-TALK. The government also has a hotline to offer help with anxiety and depression. The U.S. Department of Health and Human Services have a hotline 1-800-662-HELP. All large jails and prisons must by law offer mental health services to inmates. The state and government, both legally and politically, are trying to help with anxiety and depression by increasing awareness and providing help through hotlines and services.
Cultural environment related to potential barriers. Stigma can cause lower self-esteem, withdrawal, and secrecy. This is a barrier to both seeking treatment and adherence to treatment programs. As individuals have become more symptomatic, studies show that they are more resistant to seek help. The lack of education about mental health is a barrier. Gran, Bruce, and Batterham show that mental health literacy improves both perceived and personal stigma for an individual.
Cultural environment as related to an international scope. Studies suggest that a greater fear, shame, and stigma to mental health is exhibited in developing countries than in developed countries. In Asia, mental illness can be considered a curse, and many people are shunned both in their professional and personal lives. Native or indigenous peoples may have many different perspectives about mental health. Psychological and physical are not differentiated, and emotions may be described in a physical complaint.
Health disparities related to socioeconomic status. Poverty can make affordability of care a challenge and place a barrier for care. The lower the socioeconomic status, the more mental health difficulties. Low socioeconomic status causes increased stress in the home, resulting in higher rates of anxiety and depression. Low socioeconomic status results in bullying, which causes anxiety and depression.
Health disparities related to race and ethnicity. Research indicates that American Indians and Alaskan Native populations have disproportionately higher rates of mental health problems than the general U.S. population. Some of these mental health problems have been directly linked to the intergenerational historic trauma forced upon this population. Several cultural and structural barriers prevent Asian Americans and Pacific Islanders from accessing mental health services. Immigrants are at risk of facing inequalities in social economic status, education, and access to mental health care services. Religious discrimination against Muslims is associated with depression, anxiety, subclinical paranoia, and alcohol use.
Health disparities related to religion. Whitehead found that when an individual is religious, that they are at less risk of depression and more quickly recover from depression symptoms as compared to those who are not religious. It is found that when spirituality and religion is integrated into treatment for anxiety and depression, older adults respond well. Religiousness promoted greater perceived social support and healthier lifestyle behaviors, which in turn led to fewer feelings of depression and anxiety.
Health disparities related to gender. Women are twice as likely to experience anxiety and depression in their lifetime than men. Physicians are more likely to diagnose depression in women compared with men, even when both genders have identical symptoms or similar scores on standard measurements of depression. Women are more likely to be prescribed psychotropic medications than men. Women are more likely to seek help from and disclose mental health problems to their primary health care physicians. Men are more likely to seek out mental health specialists.
Health disparities related to geographical location. Rural areas have less access to mental health resources. Psychologists have long known that people's surroundings can influence their moods and mental health, and that mental health services are unevenly distributed in communities. Emotional distress rates are higher among people worried about neighborhood safety issues or having enough money for food or housing. The United States has some of the worst mental health-related outcomes, including the highest suicide rate and second highest drug-related death rate. Telehealth is the bridge for areas that lack access to mental health resources, making access available despite geographical location.
Health disparities according to bias. Implicit bias are simply automatic connections stored in a person's mind outside of his or her conscious awareness. Negative beliefs and attitudes about blameworthiness and helplessness of mentally ill persons. Individuals with mental illness and dangerous compared to physically ill people. People say that they see therapy as a more effective form of treatment than medicine, but are more apt to use medication over therapy. These are all implicit biases. Explicit biases are more familiar to people and are biases that people are able to identify and report. Negative biases and attitudes about helplessness, but not blameworthiness and mental illness, ill persons. People with mental illness are slightly to moderately harmless. These are all explicit biases.
Health disparities related to international scope. Argentinians consider mental health as part of their health as a whole. It is common for them to openly talk about seeing their therapist and the stressors of their lives. Argentinians have approximately 198 psychologists per 100,000 residents. The country boasts the largest number of psychologists per capita.
And these are references.